Hi everybody, it's Nurse Cathy. Hope you've had a great week. I know I have. I want to thank everybody who came out to the on-site flu clinic. We had a great time. I got to see a lot of people, and so I want to thank you again for coming out. So today we're going to talk about diabetes and how it's related to flu and COVID. Now you know with diabetes you're at higher risk for becoming ill because you have a weakened immune system. So what I want to talk today about is what you can do to prepare should you become ill. And the number one thing you need to do is stock up. The first thing that you'll need to do is to stock up on your diabetic supplies. You're going to have to make sure that you've got plenty of insulin and or diabetic medications that you take, and you have plenty of diabetic test strips and lancets. Now, if you become ill, there's a possibility that you might be taking your blood sugars a little bit more frequently, so that's why you want to have the extra supply. It's recommended that you have at least a 30-day supply, but if you're fortunate enough to have 90-day scripts written and you've got a 90-day supply, that would even be better. The next thing you should stock up on is non-perishable food. You want to stock up on your canned soups, your crackers, jello, pudding, instant cereal, and also unsweetened applesauce. You also might want to stock up on some sports drinks and some juice boxes. Next, I want to talk to you about your medicine cabinet. You want to make sure that you have Tylenol and ibuprofen. You want to make sure that you have some over-the-counter anti-diarrheal medication, also some upper magnesia, and maybe some over-the-counter antacids. You might also want to stock up on some nausea medicine. What you can do is you can talk to your doctor about it, and he can order maybe some oral nausea meds such as Zofran, or he can also possibly order some suppositories. Now, if you're not eating or drinking as you usually would, you might have to do some carb replacement because you are still going to be taking your insulin and or diabetic medication as you usually would. Now, if you're diabetic, the main concern that physicians have is that you might develop, because you're not eating and drinking appropriately, you might develop diabetic ketoacidosis, which is called DKA. Now, with diabetic ketoacidosis, what happens is if there's not enough insulin and glucose circulating around, your body will take fat and use it as fuel. And then that fuel causes keto production. And if there's an excessive amount of ketones, then that's when you develop diabetic ketoacidosis. That's probably one of the main concerns a physician will have should you become ill since you're diabetic. And if that would happen, you need to let your doctor know right away. So in order to determine that, you can get some test strips, and you can pick them up at the local pharmacy, and it's a urine dipstick which you can test to see if you have ketones. Be sure to check that regularly, especially if you're not eating or drinking. It's also important that you take your temperature. So the next thing I want you to have on hand is a thermometer. It's very important that you take your temperature to assess for illness. Now, when you take your temperature, also consider when was the last dose of Tylenol or ibuprofen you've had. Because if you at any point have to call your doctor, one of the first things they're going to ask is, do you have a temperature? And they're also going to want to know if it is how soon it was that you received the Tylenol or the ibuprofen, because it could alter what the actual reading of your temperature is. Now, if you become ill, you're going to want to take your blood sugar at least every 4 hours. Now, also record those results because that'll be important to see how your blood sugars are trending. Now, if you do have such as a Medtronic pump, insulin pump and sensor, you might want to also do a glucose stick, because if you're taking Tylenol at the same time, the results on the Medtronic could be a little bit different than what actually is your blood sugar. The next thing that you're going to want to do is to drink lots and lots of water. Keep yourself very hydrated. Preferably anything you drink should be a non-calorie drink, but if you just have to have something with a little bit of sweetness in it, just make sure that you take sips and you don't consume a large amount of a sugary beverage. The next thing that you should also do is weigh yourself daily. If you notice that there's been a significant weight loss in just a very short period of time, that is usually a signal that your blood sugar is going up. Now, I just want to give you a few suggestions for me on what I think would be good suggestions for you to plan ahead should you become ill. The first thing I would do is talk to my doctor in advance, what he or she would recommend that you would do should you become ill, because they're the person that knows you the best and knows about your medical condition. So I would have a conversation with the doctor so that you could develop a care plan. What I would do then is write down your care plan, because you don't know whether you're going to be able to care for yourself or someone else is going to have to care for you for a few days while you're ill. Now, you might say, oh, well, my husband or wife, they can help me. Problem is, even though somebody lives in the same home with you, doesn't necessarily mean that they know or understand how you manage your diabetes. I would include in my care plan instructions on what you would need for diet replacement. I would also include in that a location of where all your diabetic supplies are and where your over-the-counter medications are located, and consistently have those in that same place and located so it'll be easy for a caregiver to find them. I would also include your doctor's contact information. I would include copies of your insurance and medical cards or any necessary paperwork. A copy of your driver's license is also helpful too. I would have a list of all your current medications, a list of any allergies that you might have. The reason I would do this is because you don't know who's going to be taking care of you, and at some point in time you might not have to go to the hospital. And all these questions would be asked at the hospital, or even if you went into the physician's office, they might ask these questions of you because maybe you're going to be too ill to talk. The next thing I would do is choose 2 people that could be possible caregivers for you in case that you would become ill and needed some help for just a few days. Let them be aware that you are being proactive and that you have a care plan established for you should you become ill. My hope is that you're going to stay safe and healthy. The other thing that I would recommend is, just kind of a side note, is that you maybe have a small bag with just some toiletries in it, that should you have to go to the hospital, you would at least have toothbrush, toothpaste, maybe some deodorant, things like that. Just a small little bag for you that would be readily available if someone had to take you to the hospital. Like I said, my goal is that I hope you stay safe and healthy this year and that you're not ill. Now, I do want to remind you that if you haven't gotten your flu shot, you need to get that done before the end of October is being recommended by the CDC. So try to get that done and follow CDC guidelines. Continue to wear your mask, social distance, and be sure to wash your hands. That is a great way to prevent spread of infection also. That's basically all for me today, but I do want to remind you also on Monday to tune in to Beyond the Table. Ashley will be talking about the keto diet. That's, I think, going to be a lot of interest to a lot of people, and also intermittent fasting. So take care and have a great weekend.